Numerous OET aspirants have voiced concerns regarding Mihiraa's listening sample 4, Part B. Here, we provide clarifications outlining the rationale behind the design of our Part B. Now, look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now, look at question 25. Question 25. You hear a physiotherapist talking to an IT consultant regarding nerve irritation. Now read the question.
Mihiraa, ever felt that pins and needles sensation creeping up your arm after hours at the keyboard? That, my friends, is likely nerve irritation, a common consequence of repetitive work tasks. Mihiraa, think of nerves as delicate wires sending messages between your brain and body. Repetitive motions can pinch, rub, or compress these wires, causing tingling, numbness, or even weakness. But fear not, desk warriors. With simple tweaks, you can untangle those nerves and reclaim your workday comfort. Mihiraa, firstly, listen to your body. Take frequent breaks to stretch and move, even if it's just a quick wrist rotation or shoulder roll. Secondly, adjust your workstation. Make sure your monitor's at eye level, your keyboard and mouse are within reach, and your chair supports your lower back. Lastly, vary your tasks. Mix up typing with filing, phone calls with brainstorming, give your nerves a break from the same old rhythm. Remember, Mihiraa, prevention is key. By making these small changes, you can keep your nerves happy and your workdays humming.
Answer is option A. Repetitive work can irritate nerves, causing discomfort. Rationale. The main takeaway from the physiotherapist's talk is option A. Repetitive work can irritate nerves, causing discomfort. The physiotherapist explains that the pins and needles sensation in the arm after hours at the keyboard is likely nerve irritation, a common consequence of repetitive work tasks. The talk suggests that repetitive motions can pinch, rub, or compress nerves, leading to tingling, numbness, or weakness. The emphasis is on the need to address this issue caused by repetitive work through simple tweaks and preventative measures. Option B. You should quit your job if you experience nerve irritation, is not supported by the information in the talk. The focus is on making small changes to prevent and alleviate nerve issues, rather than advising people to quit their jobs. Option C captures a key aspect of the physiotherapist's advice, but it does not fully encompass all the recommendations provided in the talk. The physiotherapist recommends a combination of various suggestions: listening to your body, taking breaks to stretch and move, adjusting your workstation for ergonomic comfort, and varying tasks to prevent nerve-related discomfort. Question 26. You hear an ENT talking to a young patient about earbuds. Now read the question.
Hey Mihiraa, ever wondered why we have this amazing gooey stuff called earwax? It might seem gross, but it's actually a superhero in disguise. It traps dust, dirt, and even tiny bugs before they can give your ears trouble. But sometimes, even superheroes need a little backup. That's where ear cleaning comes in. Now, Mihiraa, I know some folks like to use earbuds for this, but let me tell you a secret. They're not the best partners for your ears. Think of your ear canal as a delicate tunnel, and earbuds are like clunky bulldozers trying to navigate it. They can actually push wax deeper, causing blockages and even pain. Plus, those little nooks and crannies on earbuds are perfect hiding spots for bacteria, which can lead to nasty infections. So, what's the best way to clean your ears, you ask? Well, for most folks, gentle wiping with a soft washcloth and warm water is all you need. And remember, never stick anything smaller than your elbow in your ear, not even cotton swabs. Those guys can damage your eardrum, which is like the VIP section of your inner ear, not a place for uninvited guests. Mihiraa, if you're having trouble with stubborn wax, that's where your friendly neighborhood ENT doctor comes in. We have special tools and techniques to safely remove wax without any superhero-sized mishaps. Remember, Mihiraa, your ears are delicate instruments, so treat them with care. And next time you're tempted to use an earbud for cleaning, just hum this little tune: earwax is my friend, earbuds are not, keep my ears happy, that's the plot.
All three options are valid risks mentioned by the doctor, making this a tough question. However, the main risk of using earbuds for ear cleaning, according to the doctor, is captured in option A: they can damage the eardrum. Let's discuss each option. A: they can damage the eardrum. This is the correct answer. The doctor in the passage warns that earbuds are like clunky bulldozers in the delicate ear canal. They can push wax deeper, causing blockages, and importantly, they can damage the eardrum if used for cleaning. The eardrum is described as the VIP section of the inner ear, and the doctor advises against inserting anything smaller than your elbow into your ear. B: they can push wax deeper, causing blockages. While this is also mentioned in the passage as a risk associated with using earbuds, the primary emphasis is on the potential damage to the eardrum. Pushing wax deeper is a concern, but it is a consequence of the broader risk of damaging the delicate structures inside the ear. C: they can harbor bacteria, leading to infections. While the passage does mention that the nooks and crannies on earbuds can be hiding spots for bacteria, the main emphasis is on the physical damage that earbuds can cause rather than the risk of infections. In summary, the main risk highlighted by the doctor in the passage is the potential damage to the eardrum, supporting option A as the correct answer. Question 27. You hear a conversation between two nurses about a patient's change in pain dosage. Now read the question.
All right, Mihiraa, let's talk to Mr. Jones. Pain's been a real bear the past few hours. We upped his oxycodone to 10 milligrams as per Dr. Lee's orders, but it barely touched the edge. He's still wincing with every breath, poor guy.
That's odd. 10 milligrams should have put a dent in that fractured rib pain. Did you check for any other causes? Maybe a new pressure ulcer or something.
Mihiraa, skin's clean, vitals are stable, no signs of infection. He just keeps saying the pain feels different somehow. Sharper, he calls it.
Interesting. Maybe a nerve block could be worth exploring? Dr. Lee mentioned considering it if the oxycodone wasn't effective.
Yeah, I thought about that too, Mihiraa. But his BP dipped a bit earlier, so I hesitated to push anything else without you here.
Right call. Let's get him assessed first thing in the morning. Meanwhile, maybe try alternating with some Ketorolac for the sharper edge. It might hit the nerve component better.
Good thinking. I'll get that ordered before I head out. Thanks, Mihiraa. You're a lifesaver.
Anytime, Sarah. Just another day in the pain management rodeo, right?
The correct answer is C: the pain has a different, potentially nerve-related component. Here's the reasoning for each option. A: the oxycodone dosage was not high enough. While this is a possibility, the conversation suggests that 10 milligrams is a significant dose that should have provided some relief. Additionally, Sarah mentions Dr. Lee considering alternative methods if the 10 milligrams wasn't effective, implying it's a reasonable dosage. B: Mr. Jones developed an allergic reaction to the oxycodone. This is less likely because there's no mention of any new symptoms like rash, itching, or wheezing, which are common signs of an allergic reaction. C: the pain has a different, potentially nerve-related component. This directly aligns with the highlighted details in the conversation. Sarah mentions Mr. Jones describing the pain as different and sharper, which could indicate nerve involvement. Additionally, Emily suggests trying a nerve block and ketorolac, both pain management options specifically targeting nerve pain. Therefore, based on the specific clues and the discussion of alternative treatments, the most likely explanation for Mr. Jones's pain resistance is a different, potentially nerve-related component. Question 28. You hear a conversation between a nurse and a doctor about a patient's discharge. Now read the question.
Dr. Evans. I'm worried about Mrs. Georgina, she blurted out. She seems down. Refuses to eat, barely sleeps, doesn't even pick up her knitting anymore.
Mihiraa, I know her vitals are fine, medication adherence is spot on, but the chart paints a bleak picture. Her MOCA score suggests mild cognitive decline and the Beck depression inventory.
Grim. Discharge feels premature, don't you think? Her home support is shaky at best, that distant niece won't even return calls.
I hear you, but keeping her here without a clear medical diagnosis is unethical. Besides, this hospital isn't equipped for long-term mental health care, Mihiraa.
But what about the fall risk? She barely sleeps, stumbles at night, and those panic attacks. Remember the one in the cafeteria?
We can schedule home safety assessments and equip her with alarms. And for the panic attacks, her antidepressant dosage could be adjusted. Look, Mihiraa, let's try a compromise. Discharge with intensive home care, daily nurse visits, and a telepsychiatry consult every other day. We can reassess in a week.
You really think it could work?
It's a delicate balance, Mihiraa. Mrs. Georgina needs a familiar environment, some semblance of normalcy. And with close monitoring, we can intervene if things worsen.
The correct answer is C, inadequate support system and potential worsening depression. While all options are mentioned in the conversation, the main focus is on Mrs. Patel's mental health and vulnerability at home. Here's why. A. Lack of medical justification for hospitalization. While Dr. Evans acknowledges the lack of a clear medical diagnosis, he proposes discharge because the hospital isn't equipped for long-term mental health care, suggesting this isn't the primary concern. B. Increased fall risk and panic attacks at home. These are discussed as risks to address by adjusting her medication and setting up home safety measures. They are important concerns but ultimately serve to mitigate the main worry. C. Inadequate support system and potential worsening depression. This is the recurring anxiety throughout the conversation. Nurse Johnson's worries are about Mrs. Patel's well-being in an unsupported environment, and Dr. Evans' proposed compromise aims to address this directly with intensive home care and mental health support. Therefore, the primary concern is ensuring Mrs. Patel's mental health and preventing potential worsening depression amidst an unreliable home support system. Question 29. You hear a presentation by a professor about robotic surgery. Now read the question.
Welcome, everyone, to the brave new world of robotic surgery at Mihiraa's laboratory. Today, we'll dissect this burgeoning field, exploring its marvels and, yes, its hidden stitches. Imagine this, a surgeon, miles away, manipulating robotic limbs with pixel-perfect precision at Mihiraa's testing center. Inside a patient, miniature cameras from Mihiraa's technology offer a 3D battlefield of tissues and vessels. This, my friends, is the future of surgery. But, this revolution comes at a cost, a hefty one. Millions per robot, skyrocketing healthcare expenditure. Can we truly justify such extravagance for every scalpel incision? Fear not. The ethical surgeon, the mindful engineer at Mihira's, they work tirelessly to democratize this technology. Miniaturization, open-source software, AI-powered assistance from Mihira's research division, these are the threads weaving a tapestry of affordable access. And the benefits, oh, the benefits. Minimally invasive procedures, shorter recovery times, reduced trauma. For children like this, robotic surgery is a lifeline, not a luxury at Mihira's medical center. But, a chilling question lingers: when machines wield the scalpel, where does the human touch reside? Can cold steel ever truly replicate the empathy, the intuition that defines the art of healing? This, my friends, is the crux of our journey at Mihira's laboratory. To harness the power of robots without sacrificing the soul of surgery. To write a symphony where technology and humanity dance in perfect harmony.
Question 30. The correct answer is B. While promising, robotic surgery must prioritize affordability and ethical considerations. While the professor clearly presents robotic surgery as a transformative technology, they dedicate significant time to highlighting the challenges of cost, ethical implications, and the importance of maintaining the human touch in healthcare. This balanced approach, acknowledging both the potential and concerns, underpins the main argument. Here's why the other options are incorrect. A. Robotic surgery is the definitive future of healthcare, cost be damned. While the professor emphasizes the benefits, they also raise the issue of cost and the need for responsible implementation. C. The human element of surgery is irreplaceable, and robots should remain assistants, not replacements. While the professor values human empathy, they don't entirely dismiss the potential of robots as surgeons, but rather advocate for a collaborative approach. Therefore, the professor's main argument champions the potential of robotic surgery while urging careful consideration of its ethical and financial implications, advocating for a future where technology enhances, but doesn't replace, the human element of healthcare. You hear a morning briefing in a hospital ward. Now read the question.
All right, team, let's tackle the communication gaps that cropped up yesterday. Mrs. Thompson's case, her new medication schedule wasn't properly updated in the system. I ended up giving her the wrong dose. And Mr. Hernandez, his x-ray results got lost somewhere between radiology and his chart. We were operating blind for hours. And don't get me started on the discharge orders. Mrs. Mihiraa was almost sent home with the wrong prescriptions. I hear you all, these lapses are unacceptable. Patient safety hinges on clear, accurate communication. But here's the thing, the fault isn't always on the system or individual forgetfulness. We need to break down these silos, folks. Nurses, doctors, specialists, we're all part of the same team. We need to talk to each other, not just at each other. These new communication boards, these daily huddles, they're not just suggestions. They're lifelines. Use them, question, clarify, double-check. Let's build bridges, not walls, with our words. The correct answer is C, a culture of siloed communication between different departments and roles. While individual mistakes and technological glitches are mentioned, the crux of Dr. Lee's message lies in addressing the underlying communication culture. He emphasizes the need for collaboration, open communication, and breaking down the barriers between departments and roles. Here's why the other options are incorrect. A. Individual negligence and forgetfulness among healthcare professionals. While Dr. Lee acknowledges mistakes, he doesn't solely blame individuals. He focuses on the systemic issue of communication breakdown. B. Lack of technological infrastructure to support communication within the hospital. The whiteboard and huddles mentioned suggest that technology is already present. Dr. Lee's emphasis is on changing the communication culture, not adding new tools. Therefore, Dr. Lee's main concern is the entrenched culture of siloed communication within the hospital, which he aims to address through increased collaboration and open communication across departments and roles.
Thank you for watching. Please Like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.